Okay, hello everyone. Welcome to today's webinar in our Counter Tools Healthy POS webinar series. The title of today's webinar is A Dive into the Food Retail Environment. I'm your moderator. My name is Jackie Boards. I'm a project director and the help desk manager at Counter Tools. And our presenters for today are Heather D'Angelo, Joel Gittleson, and Melissa Laska. And let me do a quick sound check and make sure you all see my slide on the screen. So can you all drop on the chat box if you can hear me and see my slide on the screen? Just put a yes or a no. Okay, great. It looks like everyone can hear me and see my slide. Okay, we'll continue on. So for a little bit of webinar housekeeping, so we're using Zoom right now for this webinar. You all are muted by default, so only I as the host can unmute you, but you will likely not need to be unmuted unless you really have something you really want to say. Secondly, you all have access to a chat box, so I want you all to just drop in any general messages or comments or things like that. If you're having any technical difficulties, drop those into the chat box. The raise hand function we're not going to really use today, so you don't have to worry about that function. And then Q&A, so if you all have more specific questions related to the content that we're going to be talking about today, just please drop those in the Q&A box. So for more random, more general things, drop those in the chat box, and for more questions on the actual content, drop those in the Q&A box. Before we get started, let me make sure anybody has any questions. If you have any questions, drop those in real quick. If not, we'll go ahead and go on. Okay. Looks like no one has any questions, so we'll continue. So I wanted to give a little background on us here at Counter Tools and what we do. These are the 6 big buckets of what we do here at Counter Tools, and our kind of mission and what we want to really accomplish is helping to empower communities to become healthier places by these kind of 6 different buckets. I'm going to talk about each one in a little bit of detail. So the first one is empowering communities to become healthier places by educating and coaching individuals and groups. So we do a lot of different trainings and webinars, and we go to people and we really try to educate them and coach them on whatever topic is of interest. Specifically, we do our work around point of sale or POS, and we do some tobacco, food, and alcohol work in that arena. We also provide mission-driven software tools. So we have a tool called the Store Audit Center, which is a mobile data collection tool that people can use to collect assessment data in their community. So seeing what products are being sold, what the prices of those products are, where they're placed in stores. It's a really good tool for that. We also have the Store Mapper, which is more of a visualization tool. So you can see where retailers are located in the states. Like, for example, this is a Minnesota map, and you can see that kind of in the more southern part, there's a huge cluster of retailers, and the retailers are the red dots in that area. So through the Store Mapper, you can really understand what's happening in specific areas and target resources and policy change towards those areas. And we also have an additional software tool, Post, which is our new tool. It's, again, a kind of mobile data collection tool that people can use to collect assessment, enforcement, and education data. We also share research and best practices. So you all are on this quarterly webinar. So we have quarterly webinars that happen in our Healthy POS webinar series. And we also have a podcast, if you all did not know. So that is available on iTunes and also on our website. So definitely listen to the podcast if you haven't. We have it on some really interesting topics. And if you want more information about that, I can definitely send it to you afterwards. We also synthesize evidence and stories. So we create things like infographics and static maps and other things like that. And I want to point out this really great resource, countertobacco.org. It is a project of us here at Counter Tools. And on that website, you can find the latest and greatest in research, specifically around the point of sale. You can find ideas for policy solutions, resources, and tools like youth engagement activities. But you can also find a really cool media gallery. What we have each year is like a photo contest where people submit their pictures from what they see in their communities. And so we have a really good repository of pictures from all across the country. So that's a really great place to go. So please visit countertobacco.org if you haven't. It's a really great resource. And the URL for Counter Tobacco is exactly how it reads, countertobacco.org. Okay, so that's a little bit about us. I know most of you all have worked with us before, but some of you all haven't. So definitely happy to answer any questions or any thoughts you have after the webinar. So definitely I will provide a follow-up email after this webinar, and I can answer any questions you have about the work we do at CounterTools. And just as a note before we get right into the webinar content, so we're going to be taking questions throughout the webinar, but we're only going to be answering them at the end. So please definitely drop your questions in as we go along, and then we're going to have a period at the end of the webinar to go through all of the questions. So please ask questions, make comments. If something interests you, drop it into the chat or the Q&A box, and we'll tackle those at the very end. Okay. So I want to introduce our speakers, the most important part of this webinar. So we have Heather D'Angelo. So Heather D'Angelo is an assistant scientist at the University of Wisconsin Carbone Cancer Center. D'Angelo is a social scientist whose research focuses on how policies, environments, and social contexts contribute to health disparities among vulnerable populations. She has a special interest in how neighborhoods, built and social environments influence health behaviors related to cancer risk, such as diet, physical activity, and tobacco use and cessation. Dr. D'Angelo has a PhD in health behavior from the University of North Carolina at Chapel Hill and a Master of Health Sciences in International Health from the Johns Hopkins Bloomberg School of Public Health. She completed her postdoctoral work as a cancer prevention fellow at the National Cancer Institute. Then we have Dr. Joel Gittleson. He is a professor in the Center for Human Nutrition and Global Obesity Prevention Center. Dr. Gittleson is a public health nutritionist who focuses on developing, implementing, and evaluating community-based programs for the primary prevention of chronic disease in disadvantaged ethnic minority populations. With more than 265 publications, Dr. Gittleson has led multiple food source-centered intervention trials aimed at providing the food environment and providing education needed to support healthy food choices and reduce obesity and diabetes in Native communities, Baltimore City and Pacific Islander communities. Dr. Gittleson developed a multi-institutional program for diabetes prevention in 7 First Nations in schools and food stores, which has been extended to 11 American Indian communities and includes work sites, social media, and policy components. These programs have shown success in increasing knowledge, healthy food purchasing and consumption, in reducing obesity, and in improving stocking and sales. And lastly, Dr. Melissa Alaska is a professor of epidemiology and community health at the University of Minnesota. She also serves as director of the university's program in public health nutrition and co-director of the Obesity Prevention Center, as well as a member of the National Advisory Committee for Healthy Eating Research, or HER, a national program of the Robert Wood Johnson Foundation. Her expertise is in nutrition and obesity prevention, and over the past decade, she has led a multifaceted research portfolio with particular interest in modifiable and contextual determinants of obesity, dietary patterns, and food environments. Her work has been supported by the National Institutes of Health, U.S. Department of Agriculture, Centers for Disease Control and Prevention, CDC, and American Heart Association. And she has published 135 peer-reviewed manuscripts to date. Overall, Dr. Alaska's work has been influential in the field, having been cited in more than 6,200 times in journals, published in 24 languages from 100 countries. Her published work has been utilized in key recommendations and reports of the National Academy of Sciences Engineering, and Medicine, including the Institute of Medicine, Dietary Guidelines Advisory Committee, American Academy of Pediatrics, Academy of Nutrition and Dietetics, American Public Health Association, Office of the Surgeon General, Centers for Disease Control and Prevention, and the Lancet Commission on Adolescent Health and Well-Being. So as you can see, we have a really great group of speakers today, and I'm going to hand it off to them now. Our first speaker is Heather D'Angelo. So Heather, can you go ahead and unmute yourself, and we're ready for you.
Great, thank you so much. So good afternoon, everyone. My name is Heather D'Angelo. I'm going to provide some background and describe the rationale, aims, and methods for the studies that we will be discussing during this webinar. After that, Dr. Gillis and Dr. Lasko will present the results of our studies. Thanks, Jackie. So from your work in the tobacco retail environment, you may be familiar with the fact that lower income and racial and ethnic minority neighborhoods tend to have lower access to supermarkets, while small food stores like convenience stores and corner stores are commonly used food sources. However, corner stores or convenience stores typically don't sell healthier food items like fresh produce, while energy-dense foods and sugary beverages are common. Next slide. So to address healthy food access in lower income communities, interventions working with small food stores have resulted in increased healthy food availability and an increased sales and purchasing of more healthy foods. And there's evidence from both interventions and cross-sectional studies in this area of research that when fresh fruits and vegetables are available in small food stores, customers will purchase them and consume more servings of fruits and vegetables. But we've also learned from talking with small food store retailers that there are common barriers to stocking healthier foods. So for example, retailers perceive that there's low customer demand. They cite low profitability for healthier food items, a lack of space or equipment constraints, so they may not have appropriate coolers or things to store foods that might spoil more easily. And so one of the key things that we need to understand is how do we address those barriers and how do we help retailers stock healthy foods in their stores? So first, what we need to understand is how retailers make decisions about which products to stock, promote, and display prominently in their stores. Next slide. However, this is a gap in the literature, and you can click on through, Jackie. We actually know very little about the nature of the types of agreements that small food store owners and managers have with the manufacturers and distributors of both healthy and unhealthy foods in their stores. And we don't really know what the impact of these types of agreements are on healthy or unhealthy food availability and marketing at the point of sale. But what we've learned from tobacco control research is that cigarette companies in the tobacco industry offer contracts and incentive programs to retailers that shape what brands and products are available, promoted, and displayed prominently at the point of sale. Next slide, which many of you are well familiar with. So it's when you walk into a convenience store and you see the tobacco products displayed prominently at the point of sale, marketing, promotions for cigarettes displayed prominently, it's contracts with tobacco companies that create the store environment that looks like this. Next slide. So here's an example of an actual contract offered by a cigarette company. You can click on through, there's some links. So the contract states that retailers who sign on with the tobacco company, they must meet a specific sales volume. They have to use the industry-provided branded displays for the products. They have to place the products near the register or the point of purchase and in clear view of the customer. And there are also specific requirements on the exact amount of space that must be allocated to their product displays. So the tobacco industry provides to the retailers slotting fees or cash payments, free and discounted products, free shelving, displays, and marketing materials. And in return, what the industry gets is the prime placement of their products, making sure their marketing is displayed prominently at the point of sale, right in view of the customer. Next slide. And so to address the gap in knowledge that we have about the types of agreements that small food stores have with food and beverage companies, our study investigated the role of food and beverage distributors in the sourcing and marketing of 5 different product categories in small food stores. So we looked at confectionery or candy, sweet snacks, savory snacks, frozen treats or ice cream, and sugary beverages. Next slide. And for our methods, we recruited retailers of small food stores in 4 cities: Baltimore, Minneapolis, St. Paul, San Diego, and Durham, North Carolina. Stores were eligible if they were convenience stores or grocery stores, if they were not chain or corporate managed, and if they had 3 or fewer cash registers in order to define a small store. And then once we determined store eligibility, we recruited retailers who were owners or managers and were at least 18 years old. They had to have at least 1 year of experience in the store and be responsible for negotiating purchase agreements with sales reps or distributors. And as a result, we had 72 retailers participate in our study. Next slide. We collected data in 2013 and 2014 in the 4 cities that I mentioned. So it was a multi-site study. We used a mixed methods approach and a semi-structured interview guide that included both open-ended and closed-ended questions for our interviews with store owners or managers. This was followed by an in-store observation. So our interview guide was developed based on previous research and experience from the investigators and revised through an iterative process. We held trainings over conference calls so that we standardized data collection across the 4 different sites. Next slide. And so the next 2 presentations from Dr. Gittleson and Dr. Laska will go over some of the results of the studies that we published. So first we'll talk, Dr. Gittleson will talk about the qualitative results, and then Dr. Laska will present sort of a deeper dive into the results by product type. And so I'll hand it over to Joel now.
Next slide, please. Good afternoon, everyone. My name is Joel Gittleson, and I'm at this Johns Hopkins Bloomberg School of Public Health. And I'm going to focus on the store owner perspective on formal and informal agreements between small food outlets and food and beverage distributors. Next slide. So the aims of the study and overall were to identify types of agreements, both formal or informal, that exist between small store owners and food and beverage distributors, to address this gap that, that Heather just mentioned in the literature. We wanted to assess how small store owners and managers perceive their relationships with manufacturers and distributors, and ultimately to suggest ways that we could increase the stocking and promotion of healthier foods in these small food stores. Next slide. So as was mentioned, we did 72 in-depth interviews with small store owners and managers, and these were transcribed and in some cases needed to be translated into English. About 10 of the 72 were conducted in Spanish or Korean. Next slide. This gives a summary of some of the sample of 72 stores and store owners. You can see, I won't go into great detail, but you can see data on the number of cash registers, the very small number of store aisles. You'll see that 90% of our respondents were male, on average about 48 years, and had an average of 7 years managing the store. Next slide. We did qualitative data analysis of the textual data. This included using a software program called Atlas TI that focuses on textual analysis. We developed 47 codes. This was developed by the entire study team. And the next set of topics down there are the categories of codes that we developed. And you can see they covered six, seven different categories, and each of these had subcodes. We use something called the constant comparative method to identify key themes. And our goal is really to present the viewpoints of the small store owners and managers in this presentation. Next slide. So what were the types of agreements that we found? First of all, it was important to note that most of the small stores that we worked with actually had many distributors and suppliers that they were linked to. Also, importantly, very few formal written contracts existed. So unlike the tobacco situation, where I would say the majority of the relationships are based on formal contractual agreements, in terms of foods and beverages in these small stores, there were very few formal written contracts. But on the other hand, there were many, many formal, informal agreements, and these took several different forms. Next slide. So, as mentioned before, the written or formal contracts are common with tobacco companies in these stores, but quite uncommon with food and beverage suppliers, with the exception of Minneapolis, where we did find a more frequent mention or reporting of these kinds of agreements with small store owners and distributors. Next slide. Much more common were informal agreements, and many small store owners and managers spoke of having to make initial arrangements with suppliers to get their small store noticed. So in other words, they often bemoaned the fact that they didn't have a contract, that they actually had to go out and contact these suppliers and distributors in order to get their stores stocked. And so this was an initial challenge that they faced. Next slide. A key form of informal agreement, and perhaps one of the major forms of informal agreement that was mentioned by the small store owners, were financial agreements. And this included many different types of financial agreements. So this could include reduced prices on the product in exchange for dedicated shelf space, small incentive payments for meeting sales quota. So that sounds very similar to the tobacco situation. The ability to purchase product on credit, free delivery of the product, or the provision of free product, at least initially when introducing a new product. Next slide. So just wanted to say, provide some examples, a few more examples of some of these. In terms of the reduced price, this small store owner in Minneapolis said, but then and he mentions the name of a particular snack company, we haven't, it's just a verbal contract. I don't think there was anything we had to sign or anything, but for a certain amount of shelves and a certain amount of space, we get a percentage off. I think it's like 10% that we get off. So this reduced price for dedicating shelf space to the product was something that was mentioned commonly. Next slide. Another common mention was the reduction of prices for meeting a specific sales goal. And so this particular respondent in Baltimore said that they get a discount if they reach certain sales goals. So in other words, if they sell $300 of the product a week or $500 a week, they get a specific discount. In this case, it was mentioned to be 2 or 3%. Next slide. And small store owners also spoke about different kinds of incentive payments that they received. So in this case, in Durham, the store owner said, so that if this particular store has to sign with that company, then they can provide us that promotion to us, like you have to buy all the product from the company, so then the company will provide you at the end of the year like $25 or $50, like that. Next slide. Another form of informal agreement that exists between distributors, suppliers, and small store owners and managers is the provision of equipment. And this was quite common. This included display racks for chips and snack cakes, refrigerators for sodas and other beverages, and freezers for ice cream. And usually these were brand identified, and the requirement was that the store owner would place most or only that product in that particular piece of equipment. Next slide. So this is an example or a statement that from San Diego that related to this required placement. the store owner said sometimes they want you to know a little cooler up front that has ice or something in it, and they give you a better deal on certain products if you put a freestanding cooler, but they want it up front. It doesn't necessarily have to be right here, but maybe they want it in the front of the store. They don't want it in the back corner of the store. So the display placement was also part of the agreement, not just what you put inside the equipment supplied. Next slide. A threat point that was reportedly used by several of the suppliers and distributors that supplied equipment for the display or provision of specific food items was that if stores did not meet certain sales quota, then the distributors and suppliers that had supplied that piece of equipment often would say that they would not repair it if it broke down. So it was sort of like, if you don't sell enough of our soda or enough of our ice cream or what have you, we're not going to repair that. Next slide. So the perceptions of the relationships from the perspective of small store owners that they had with their distributors and suppliers, what I would have to say was quite mixed. Many of the small store owners who had longer term relationships tended to be positive. And many of these small store owners expressed that they felt that they were in charge of the relationship in some ways. The distributors, can't control. I have a lot of experience. I know how to handle them. I put them in their place. They cannot go over there. I make sure there's a fair share for everybody, said one small store owner. Next slide. And small store owners actually reported that if they were dissatisfied with their relationship with a supplier, that they could change that. As in terms of, in the situation of Baltimore, the small store owner said, there are many times you don't like the vendors, the way they treat you, whatever, and you don't feel comfortable. You just stop dealing with them. So, mainly they want to stay in business and act right. Or if they don't act right, then you just stop dealing with them, or they just might complain, or you just might complain to their super and complain about it. So, just sometimes vendors, they know they have no choice but to keep up with us. Next slide. In a particular strategy that we observed in, or was reported in some stores, a few store owners decided to purchase their own displays and equipment. And as one person said in Minneapolis, because all coolers are my coolers. If we have an agreement with Coke, they're going to give us a cooler, but then they want only their product in the cooler, which is Coke. So then I have my own cooler. So that's why I don't have any agree with them. Whatever I put in the cooler, Coke or another product, they can't say to me anything because I don't have any agreement with them. Next slide. And there was actually a lot of talk, though, from the other side of the picture that small stores felt that in recent years their relationship with distributors and suppliers had actually taken a downturn or a turn for the worse, and that they said that things were getting tighter. It's tougher to get merchandise delivered to their stores or get the products delivered to their stores in a timely manner, and in fact they feel overlooked. And they feel that a lot of the suppliers and distributors would really rather work with the larger stores, the larger food stores. Next slide. So this work yielded a few potential intervention strategies to consider. So first of all, I think we felt it was important to work with wholesalers and distributors to determine the kinds of agreements they offer to small stores. We need to figure out what those agreements are, and actually also how they differ by product type, and Melissa's going to talk a lot more about that in the next presentation. We should also consider thinking about other distribution models, such as small store buying collectives and bargaining units, so that small stores, which typically buy very small amounts, especially of healthier foods, if at all, have some bargaining power based on collective purchasing. We could also test something which might be termed a counter incentive. What if we, as public health people, bought out space in the store for healthier foods? Is that a viable alternative? Something similar to what companies do or distributors do in those stores. Next slide. Other strategies might be to provide open or reduced restriction displays or refrigerators to small stores, either for free or at reduced costs, and that would at least create some spaces that would be available for non-branded food items. We could think about policy as a kind of approach. which could include expanding staple foods ordinances to ensure that wholesalers are required to supply those foods at a reasonable cost to small stores. And we can also talk about supporting stores that do stock healthier foods with promotional materials. Next slide. So in summary, I would say that from the qualitative data, we found that both formal and informal agreements exist with wholesalers or distributors for small stores. However, informal agreements are far more common than formal agreements and seem to center around different types of financial incentives and equipment for the small stores. And many small store owners are feeling at an increasingly a disadvantage with their wholesalers and suppliers as compared to large stores. On the positive side, I think there are a number of potential public health intervention strategies that exist to build store owner control over their stock. And with that, I think we'll turn to Dr. Laska.
Thank you. Can everyone hear me?
Yes.
Okay, super. So I'm Melissa Laska. I'm from the University of Minnesota. And while Joel gave an overview of our findings from the qualitative data, I'm going to dive in and provide some depth in terms of the quantitative data that we were able to pull from our interviews. And specifically, we were really interested in not only capturing an overall picture of these agreements, but also trying to get a sense of how and to what extent and in what ways do these agreements and kind of things that result from the agreements vary by product type. Next slide, please. So the aims of this work are to describe how product types vary in terms of importance in attracting customers, that's from the manager or owner's perspective, perceived profitability, and also stocking practices of the distributors of those items, and then ultimately to describe how distributor agreements with retailers vary by product in terms of format, whether it's formal or informal, in terms of the incentives that are associated with those agreements, and in terms of what the distributors expect as a result of receiving those incentives. And I will say that these results from the quantitative data that I'm going to be presenting here have been published in 2 papers in peer-reviewed journals. The work that Joel had presented has also been published in a separate paper. So we have a series of papers that have kind of described these results, and we'd be happy to share those with you if you want more depth on these topics. Next slide, please. So to start off, we wanted to get a sense of the product types that we were after. We thought were important to these kinds of stores because of our previous work and the work of others in this area. But we had some general questions up front of the managers and owners about importance of the products in terms of customers, and also profitability in terms of, do you make very little on this product, or is this kind of the best of all products in terms of profitability? Next slide, please. And click one more time. What you see here, this is perceived importance, and the blue portion of the bar is where managers or owners reported that the products were quite or very important in terms of attracting customers. And so you see there for sugary beverage, sweet snacks, savory snacks, confectionery, these products are really important, maybe a little less so for frozen desserts, and it's not quite the same for fresh produce. But these 4 categories on the right are quite important in terms of customers. Next slide. And in terms of perceived profitability, and if you click 2 more times, Jackie, you'll see we see some deviation then in terms of those 4 categories that are extremely important customers. We see some deviation then in perceived profitability on the part of managers, with sugary beverages being perceived as quite profitable, savory snacks less so. We ended up, I will say, hearing a lot about sugary beverages in the interviews. People talked a lot specifically about sugary beverages in this context. Next slide, please. Following those quantitative questions, so first we asked a whole range of open-ended questions in our interviews, and we led with that, and then asked the questions that I just presented in terms of how important are the products in attracting customers and profitability. And then we kind of started to dive into some more nitty-gritty details. So we were asking For sourcing, how often does the store receive a visit? We wanted to get a sense of, you know, just how often are these folks in your store? How often do you have FaceTime with them as a reflection of, you know, what do we think that, how strong do we think that relationship could possibly be from that face-to-face contact? We asked folks, do you have agreements with these stores? What are the, or with these distributors, what do the agreements look like? What kinds of incentives do you receive? What kinds of control do those distributors have over kind of placement or other issues in the store? What kind of control do they have over signage, et cetera? Next slide, please. So how often are the products sourced? What you can see here, I'll call your attention all the way to the bottom row. Down there on the bottom, you see fresh produce, with the being the last bar on the bottom. This is consistent with what we've seen in previous work, where a little over half of the retailers in our sample reported that they're self-sourcing produce, so they don't have a distributor for produce. And again, that's quite common. We've found that 50% or a little over 50% in previous work. Then we had about 1 in every 4 or 5 retailers didn't stock fresh produce at all, and a much smaller percent that actually had a distributor coming to the store. In terms of the other 5 categories, having a distributor is much more common, and self-sourcing is less common. Particularly you see for savory snacks and for sugary beverages, you see distributors are in the store weekly or more often than that. Next slide, please. And then this is the distribution of the types of agreements, thinking about whether or not stores have no agreement with a distributor in these categories, and that bar is represented on the bottom in the white portion of the bar. So for example, 27% of the retailers in our sample said they didn't have any agreement with a distributor that provided confectionery products. But that's a relatively small percent across the board of folks that say, nope, I don't have any agreement in these categories. Most stores did have some kind of agreement. As Joel said, it did seem that informal agreements were more common than formal agreements. And these data are, the way they're presented here, maybe a little bit masking kind of the site-specific differences that we seem to observe, where one of our sites, Minneapolis and St. Paul, was more likely to have formal agreements. But you can see that that these things also vary by product type. So for example, if you look at sugary beverages, there's much more likely to be a formal agreement in place as compared to sweet snacks, for example, or confectionery. So it's just interesting to think about the distribution of these things and the shape that they take, the format that they present themselves in the store. Next slide, please. We asked the retailers, okay, so you have an agreement with somebody that supplies your sugary beverages or your confectionery. We asked them more detail about each of those agreements. So we said, you know, do you, who are those agreements with? And we asked them to name the companies that they're with. These are tallies of those reports. You can see that there's some variability in how many agreements on average they have across the product types. Interestingly, you know, when there are some categories for which there are clear market leaders in distributors. So for sugary beverages, it was clearly everybody had a contract with Coke or Pepsi or both. For savory snacks, I think about 80 or 90% of the sample had agreements with Frito-Lay. There was much more heterogeneity when we looked at some of these other product categories. Next slide, please. Overall, I think it's interesting. I found it interesting just to think about the sum of these agreements across categories. So if we just sum these 5 product categories, we have stores on average in our sample having 6 agreements, ranging all the way up to 13 agreements. So to me, that was just striking in kind of thinking about that's a fair number of agreements to be juggling, particularly when you start to get into expectations that the distributor may have around something like location control, and you have all of these distributors vying for different different parts of the store, essentially. And I'll talk a little bit more about that in a minute. Next slide, please. We also asked the retailers to estimate the monetary value of the incentives they received. Now, I'm going to ask you to interpret these results, take these results with a grain of salt, just interpret these results with caution. But we did feel that it was important to get these data out there in terms of monetary value, because we hadn't really seen this kind of quantitative description of monetary value of incentives before in the literature or elsewhere. But I will say these monetary values can be hard for retailers to estimate, we found. In some cases, the tendency was to estimate in terms of a one-time incentive, like somebody provided them with a cooler, for example, or a display rack or something, and in their head they could calculate, well, I think if I were to buy a display rack on my own, it would cost this much. There's other cases where it's easier to report as a recurring incentive. So for example, getting 10% off your monthly or quarterly invoice. And in some cases, our data here are spotty and have more missing values than elsewhere in our data, because it's sometimes just not that easy to estimate. The calculations can be fairly complex, and they know they get something off, but it's not a straight shot of just 10%. And they said, gosh, I just can't really say. So, but you see in general from the data that we have, the incentives that they get can be highly variable, both across stores as well as across product type. Next slide, please. We also looked at the types of incentives that people received for carrying a product. And if you click through again, Jackie, I think you're going to click through 5 times. Yep. So you can see kind of the standout places. Everybody across product categories, people it was very common to get displays. To some extent, at least for savory snacks, sugary beverages, and confectionery, it was common to get free or discounted products. And then for some categories, signage or marketing materials. Interestingly, payments were less common, it seemed, from our data across these food categories. Next slide, please. What the distributors expected. Can you click one more time? In general, it seemed we heard quite a lot about they expected price control, some control over price, expected some control over location in the store. It was less frequent that they expected, for example, that employees would promote their products as a result of the store receiving some kind of incentive. And less that we saw other kinds of expectations being implemented. So really price control and location control. Next slide, please. For location control, and again, you're going to click 5 times on here. For location control, we asked folks that the kind of universe that's represented on this slide are retailers that had a distributor agreement in place for a given category of food, and they reported that the distributor had an expectation of at least a little up to total control of location where those products are placed in the store. And so we asked them, okay, so you say that the distributor expects they have some or total control over the location. Where are we talking about in terms of location? And that was really scattered across product category. The sugary beverages and the frozen treats, of course, are expected in the displays and the coolers. End caps, it seemed to be more prominent in terms of savory snacks and sweet snacks. Confectionery in shelf aisles, and really seemed to be the only standout category in terms of checkout. So it's interesting to see they're kind of expecting control over different parts of the store. Next slide, please. One thing that we've really, these are a lot of data that we've just gone through, and we've spent a long time trying to put it all together in our minds and compare and contrast, and it's I think it highlights what a complex environment the retail environment can be. I mean, it's incredibly complex. And so, you know, just as a sake of comparison, you know, comparing sweet snacks, for example, to sugary beverages, the sweets for sweet snacks, retailers get these products sourced weekly in about 68% of the stores. Have a little over half have informal agreements. Most get displays as their incentive. Whereas compared to sugary beverages, about 3/4 source weekly, a much lower percent of informal agreements. It does seem like formal agreements are more common in sugary beverages. And then there's kind of there's different kinds of incentives that are associated with these agreements. And in exchange, price control was fairly common across both of these categories. A little bit of a difference in terms of location control expectations, certainly with regard to where in the store these are placed. So next slide, please. In pulling this all together, you know, Joel highlighted some of the recommendations and the thoughts that we had for future work as we kind of went through these findings. I think our results really highlight that for the food and beverage distributors of these products are really involved in the sourcing and marketing of products. And to some extent, that's not, the retailers don't really necessarily see that as a bad thing. You know, they appreciate their services. I think they bring a real value to the retail environment. But we really have to realize that the distributors are a prominent kind of factor in what gets put in the store and where it gets put. In terms of the agreements, they maintain these agreements with store owners or managers. Displays are really common incentives. Location control is very common expectation. Next slide, please. And ultimately, I think we can't think that ultimately we're going to be able to make long-term changes in stores without involving distributors in some way, that they're kind of going to be a necessary part of the equation. Finally, we've just batted this around. I don't know in terms of feasibility how much this would fly, but are there potential policy strategies that could limit the level of control that distributors have over retail environments, particularly as a way of protecting retailers that may be more vulnerable to pressures from distributors, and thinking about how, you know, you can kind of give the retailer the upper hand in operating and making sure they have the environment structured in the way they want it to be. Next slide, please. This work was funded by Robert Wood Johnson Foundation's Healthy Eating Research National Program Office. We had a number of collaborators on this work, so they're listed here. Those are the co-authors on all the papers. Next slide, please. We have some time left. Jackie, I think if it's fine with you, you know, we'd be happy to take questions or hear comments, hear what you all think of these findings, if this kind of fits with what you would have expected or not. Our contact information is listed here. We're also happy to field emails after the fact as well.
Yeah, thank you so much. So yeah, we're opening it up now for questions. So if anybody has any questions, please drop those into the Q&A box and we'll take care of those questions for you. So if you have any questions, any comments, anything, like I said, you want clarification on, please drop those in the Q&A box and we'll take the next 10 minutes or so to do so. Okay, so there's a question that came in. So can any of you all talk about slotting fees and their role in point of sale and what can we do about them? So slotting fees.
So by slotting fees, you're referring to essentially the distributor, the supplier is going to pay a certain amount of money to have shelf space. And I think
Yeah, that's correct.
right, yeah, and so what we found was tobacco. This is incredibly common, and of course in large supermarkets, it's incredibly common. It's far less common in small stores that there are these formal slotting fees, and what there are is sort of a unless you want to say that the provision of a display rack in some ways is a kind of a slotting fee. It's just not, the fee is not in terms of money, it's in terms of a display rack or a refrigerator or a freezer. So I would say that there's different forms of what we call typically a slotting fee in a supermarket setting that occur in these small, often independently owned food stores.
Thank you. Let's see. Okay, so we got another question. They said, this is so interesting. Were you able to look at any formal agreements between the retailers and distributors? If so, can you tell us any of the specific restrictions of the contracts? We hear about the informal agreements, but I'm not sure about how much those differ from the formal written agreement.
You know, when we started this work, we weren't sure what we were going to get, and we felt like we were treading on some really sensitive ground. We were really nervous that people weren't going to want to tell us anything about their agreements, and so we had talked about early on. Well, should we ask to see them? Can we do that? You know, and we said, gosh, for this, we felt like this was like our first step into this. We were just dipping our toe in the water at the time, and my memory is that we were really specific in saying, no, at this point we're not going to ask to see the agreements, because we just feel like that might be pushing things too far. In hindsight, people were willing to chat with us about this, and we, as you can see, we got quite a bit of data about the agreements. So So I'm not sure how that would have been received, and we've talked about that as the next step. But I don't know. I mean, I'll let Joel and Heather answer. I don't think I've seen something in terms of Kurt had shared something with us in terms of something that maybe like Hershey had sent out that summarized the different options that they offer stores, and kind of for a given retail sales volume, here's the incentives that we offer. But I can't say that I've seen an agreement per se.
Yeah, I operated in Baltimore, and the corner stores in Baltimore are very, very small, and I could not put my fingers on any formal agreements. It doesn't mean that they didn't exist, but I just feel that if they did exist, they were very rare.
Okay, great. So I got another question or comment. They said, you just mentioned looking at agreements as next steps. And I wanted to ask just that. What do you see as the next steps or next research questions that you want to explore based on what you found out thus far?
I mean, I think that's really a great question. Something that I'm interested in for the Baltimore context, which admittedly is not the same in many ways as many of the other low-income contexts that we worked in. But in the Baltimore context, and I think that reflected in one of the slides that Melissa presented that showed that 50, in terms of fresh produce, 50-something% of the small store owners reportedly sourced it on their own, and about 20% didn't even stock it. So 80% of them either didn't stock fresh produce or had to source it on their own. So this implies that there's a big gap, which we found in Baltimore, in terms of the distribution system for healthier food options. So just like the converse is what we found in terms of all these informal and formal agreements for the unhealthy foods, in terms of savory snacks and sweets and ice cream and sugar sweetened beverage and so forth. There are, robust informal and formal types of agreements and distribution practices that get those foods and beverages into corner stores. But if we're looking at an apple or an orange or healthier food options, these mechanisms, these distribution systems do not exist and often have to be sourced, or they do not exist in the same level, and they often have to be sourced by the owner themselves. And so, figuring out a solution, or what would be a viable solution to that imbalance in distribution of healthy versus unhealthy foods, I think is a really key area for future work.
We've also talked about, getting the distributor perspective on all this. So we only interviewed managers and owners, people that made agreements had the authority to make agreements on behalf of the store. And we didn't talk to distributors as part of this. And so that's kind of another side to this, is just gathering systematically more data on their thoughts and views and perspectives and challenges and opportunities, ways that, the public health community could work with them, et cetera.
And I would just add, can you all hear me? I think I was muted before. I would just add that, you all know from local tobacco work that a lot of changes in the retail environment for tobacco in terms of policies that have been implemented are really started at the local level. So to the extent that you can incorporate some observations of the food environment into your work and start documenting where there are disparities in unhealthy and healthy food availability, along with the tobacco retail environment, I think that is, going to go a long way to showing stakeholders and local leaders about where we have to start making changes.
Definitely. Let's see if we have any more questions. We have a question that came in that said, did you see any difference in retailers that accept SNAP?
So for Baltimore, I would say that we didn't, but this was because the vast majority of retailers, small retailers, as part of their survival strategies, all accept SNAP. So there wasn't much difference. Now, a follow-up question is, what about differences between retailers that accept WIC or don't accept WIC? And in terms of these kinds of agreements, I'm not sure, but only about 30% of the small stores in Baltimore accept WIC, and there's a lot of reasons for this, but it is tied to some degree to the healthiness of the foods that you find in the stores themselves.
Mm-hmm.
Yeah, I would say that issue with SNAP is certainly true for Minneapolis and St. Paul as well, and I think is true across the board that when you look nationally, a vast majority of retailers do accept SNAP, and I think that was true of our sample. And I don't know that we specifically looked at differences by WIC here, but as Joel points out, there's systematic differences in what in stores that are authorized through WIC and stores that aren't, whether they be related to size. I think we had some location differences in terms of stores in our sample that were WIC authorized versus not by city. And so there's some tough confounding factors that are hard to tease apart, but it's interesting to think about how there could be mechanisms for healthy change through some of these federal programs, which is, I assume, kind of where you're going with this.
Mm-hmm. Definitely. And we'll take one last question before we end. So, did any of the distributors discuss their concerns around profit margins and healthy food products? This person just was curious.
So the interviews that we did for this particular project were primarily focused at the small store retailers. And so we didn't have, that I recall, lengthy discussions as part of this work with the actual distributors and suppliers. That said, in other work that I've done in Baltimore, of course, we've had discussions with distributors and suppliers, and of course they're concerned about this, and of course they actually express very similar perspectives as we hear from corner store owners or small store owners who say things like, well, there's no interest in these foods and in the community, and wholesalers will say the same things about corner store owners. There's no interest in these foods amongst corner store owners. And I think that there's a large challenge in perception and communication that has to take place at multiple levels, not just in terms of increasing demand at the consumer level, but also figuring out ways to communicate that in a ways that increase demand at the small retailer level.
Mm-hmm. Mm-hmm. Okay, great. Well, thank you all so much for your feedback. Thank you all for being on the line and talking about this great work that you've done and all of these great results and information that hopefully will be helpful to everyone who is listening in. So this webinar has been recorded, and I will make the slides available. I'm going to be sending everyone who's on this webinar a follow-up email in the next couple days, and on that follow-up email, I'll have the recording and the slides available for you all. And like they mentioned, like Joel, Melissa, and Heather mentioned, their contact information is on the screen, so please feel free to contact them if you have any specific questions after this webinar. Thank you all so much for being on this webinar, and I hope you learned a little something about the food retail environment. Have a good rest of your day.
Thank you.
Thank you.
Thank you.